So, good day. I'm JP Leong. For this lecture today, I promise to stay away from anything controversial like politics or the latest on court case between Johnny Depp and Amber Heard. But allow me to indulge myself by talking about the recent champions of the UAAP men's basketball. And congratulations to the UP Maroons for winning their first championship in 36 years. The reason this is relevant to the talk is that when you talk about UP and champion in basketball, you have to go way back 36 years ago, to when I was a college freshman, when UP last won its men's basketball championship. Ang sabi nga ng mga tao is all of these players now are now grandfathers and they have their own grandchildren, which puts them fairly in the middle age to old age category. We know that osteoporosis is a disease that approaches during middle and old age, and you get decreasing bone mass. It happens to both men and women, and it's accompanied not only by a loss in bone mass but also in muscle mass. No? So we're going to talk about the role of exercise in nutrition for adults, specifically some new discoveries to enable movement. We noticed during the pandemic that an increasing number of orthopedic surgeons were becoming more active. So these are pulled from the Facebook posts of different fellows of the POA North Luzon chapter who had started to become active in biking, hiking, running, even surfing. No? And what do they have in common? A lot of them are in their 50s, approaching middle age. Some are in their mid 40s and also considered in their middle age. So why do they do it? No? According to the latest non-scientific literature or bicycling magazine, 5 reasons to ride your bike every day include enjoying your commute, decreasing diabetes and hypertension in the way, being mentally sharper, having better sex, offset overeating and achieve weight loss, and living longer. So this is from bicycling. No? But these are also confirmed by the World Health Organization. They know that there is strong evidence that compared to less active adult men and women, individuals who are more active have lower rates of all-cause mortality, coronary heart disease, high blood pressure, stroke, diabetes, metabolic syndrome, even colon and breast CA and depression. There's also less risk of hip or vertebral fractures and a higher level of cardiorespiratory and muscular fitness. People who exercise are more likely to achieve weight maintenance and have a healthier body mass and composition. So, what are the latest recommendations of the World Health Organization for exercise? The recommendation is that adults need a mix of physical activity to stay healthy. This includes a moderate intensity aerobic activity of at least 30 minutes 5 days a week or 150 minutes a week, and 2 days a week of doing muscle strengthening activities that make your muscles work harder than usual. If you want to go for more vigorous activity, you want to aim for at least 75 minutes a week. So the recommendations on physical activity for adults between 18 to 64, again, is 150 minutes of moderate intensity aerobic physical activity or 75 minutes of vigorous activity. This should be performed in bouts of at least 10-minute duration. And for additional benefits, this can be increased up to twice the recommended amount. Muscle strengthening activity should be done involving major muscle groups 2 or more days a week. So these are contained in this group. Anything that gets your heart beating faster and anything that makes your muscles work harder than usual. So for inactive people, they suggest starting with small amounts of physical activity and gradually increasing duration, frequency, and intensity over time. And the recommendation is that inactive adults and those with disease limitations will have added health benefits when they become more active. So for middle-aged men, it's a combination of aerobic activity, weight and strength training, and even flexibility and balance training. What about for older patients? Now, older adults more than 64 years of age, they still recommend 150 minutes a week of anything that gets your heart beating and faster, and 2 days a week of doing activities that make your muscles work harder than usual. You can break it up over the whole week in however way you want. Physical activity can make daily life better too, because when you're active and strong, it's easier to do everyday tasks like chores and shopping, keeping up with your grandchildren, and staying independent as you grow older. If you're old and you exercise, the benefits include having less pain, having a better mood, and having lower risk of many diseases. So this is an example. My parents are now in their mid 70s, and they're able to hold a plank for more than 1 minute straight, which is more than what I can do. So you have to do this repeatedly and often, and you'll notice that there is a price to pay. As you grow older, there are longer recovery times. No? You have to watch out for injuries, and taking short breaks feels like taking 2 months off. You can take this a couple of ways. Number one is whenever you overtrain, afterwards you need longer times to recover in between. And second, if you stop exercising for even a week and you restart, you feel like you've gone 3 steps back in your training. During the time of COVID, this is one of the main things that we looked at. What is the effect of physical inactivity on COVID? And this study, which was published in the British Journal of Sports Medicine, showed that patients with COVID-19 who were consistently inactive, which means they had less than 10 minutes of exercise per week, had a greater risk of hospitalization, a greater risk of admission to the ICU, and a greater risk of death. So we know that exercise is good. What else is missing from the equation? So basically, it's the discussion and talking about nutrition. So the WHO estimated that eliminating the major risk factors for chronic disease, which included smoking, a lack of exercise, and poor diet, could reduce the risk of CVD, stroke, and type 2 diabetes by up to 80%. Another review showed that improving intake of certain nutrients may be important in reducing progress of non-communicable diseases such as musculoskeletal disorders, dementia, loss of vision, and cardiometabolic diseases during aging. So this brings us now to the discovery that of the importance of our bones, our joints, and our muscles to our overall health. So we know that our bones, muscles, and the components of joints give the strength, stability, and frame for the muscle to move. Now, it's important for us to maintain this mobility, which can be defined as the ability to move freely and easily, and is an essential part of quality of life and a critical component of most activities of daily living. So, a combination of good nutrition and regular physical activity are necessary to maintain healthy bones, muscles, and joints. However, less than 25% of older adults get enough exercise to gain such benefits, and evidence shows that higher dairy or milk intake may help reduce systemic inflammation. So, we're here to introduce to you today some new things in nutrition which can help in mobility. The first is MFGM, or milk fat globule membrane. Basically, it's a component which is naturally present in dairy milk. It's composed of bioactive complex lipids, and these help regulate inflammatory reactions and reduce some effects of age-associated inflammation. They enhance neuromuscular function throughout life cycle, and they can contribute to the maintenance and restoration of mobility capabilities. So, milk fat globule membrane is naturally found in milk. No? But what it is it's enriched in aniline. So, the next core concept to remember is that of MoveMax. What is MoveMax? MoveMax is a combination of the formulation found in this new product, which has calcium, vitamin C and collagen, multivitamin B complexes, proteins, and MFGM as previously mentioned. What is the effect of Move Max? Now, it helps build stronger bones from the content of calcium, vitamin D, and magnesium. It helps support healthy joints, no, through combinations of vitamin C, collagen, and vitamin E, which help increase collagen production. It helps you gain muscle mass through its components of proteins, vitamin D, and magnesium. It helps increase the overall energy level, no, through the key nutrients of vitamin B complex and B complex vitamins and magnesium. So all of this is found in the Let's Move clinical study. This was published in the American Journal of Clinical Nutrition and was conducted at the Deakin University in New Zealand. Basically, it was a study which aimed to determine the effect of taking a dairy fortified drink with MoveMax and MFGM along with exercise on functional performance, muscle strength, lean mass, bone mineral content, balance, flexibility, and aerobic fitness. So for the design, they recruited 216 middle-aged healthy women who were enrolled in a double-blind, placebo-controlled randomized trial for a period of 4 months. So each group was enrolled in an exercise program, and they were then divided into an intervention and control group. The intervention group received the 2 servings a day of the 9 grams of high-quality dairy protein, 200 milligrams phospholipids from the MFGM, and key vitamins and minerals. The control group received rice milk as a placebo together with the same exercise programs. So what were the results of this study? They found a significant improvement in a range of mobility and healthy aging outcomes, which we will discuss subsequently. First of all, there was the results showed an increase in flexibility. No, they showed that it doubled the flexibility during the sit and reach test, with 76% of women in the intervention group showing improvement in flexibility. It also showed an improvement in balance, with a clinical study showing 3 times the improvement in balance in a simple closed eyes single leg standing balance test. And patients in the intervention group showed improvement in balance compared to the control and with no deteriorations. Muscle mass also increased by over 40% in the intervention group. And this was measured by 2 means using DEXA and PQCT. And these were used to measure lean muscle mass in the 2 groups. And this showed an increase in the muscle mass in the intervention group compared to the control group. Clinical study also showed an improvement in power. And this was demonstrated by an 80% improvement in jump height, showing an improvement in activities that require fast strength. This study also showed an increase in vitality, which was showed the increased levels of moderate to vigorous activity by up to 5 times compared to the control group. So this was measured by an accelerometer, which was worn by the women 24/7 and showed the amount of sedentary time versus active time. The patients in the intervention group had 5 times the amount of active time as those in the control group. Aerobic endurance improved almost 3-fold, with an increase in the 2-minute step test of 12 steps in 2 minutes versus 4 steps in the step test. So this shows that if you ask the patients in the intervention group to step up into a bench and step down for 2 minutes continuously, the patients in the intervention group performed much better than that in the control group. So this also showed that patients in the intervention group were able to move faster. And this was most importantly seen by a significant improvement in the descent times in the stair descent test. So this was done in a standardized 5-step descent. And they showed that people who would go down the steps in the intervention group were able to do it much faster. So stair descent is an everyday activity that requires mobility, lower body strength, balance, control, and coordination. And it's also very important to be able to do this well because most people who fall going down the stairs. Lastly, the study showed that patients who were enrolled in the intervention group had an improvement of bone mineral content, with a gain of 0.2% versus a loss of 0.2% in the control group. This difference is significant over a 4-month period and showing a fast gain of bone mineral content in the intervention group. So, in summary, we know that exercise is beneficial for middle-aged people, but also important is the role of nutrition, which is important in maintaining these exercise goals and gains. And the combination of exercise with a multi-nutrient fortified milk drink combined with this can help you and your patients achieve these goals. So thank you very much. And this is a group of all the orthopedic surgeons we know in our middle ages for continuing stay active. Keep staying active for everyone. So thank you very much and good evening to you all.
To say that we've had a tough year is an understatement. For most Filipino adults, the pandemic continues to pose challenges to their physical strength, all because they have to exert extra effort at work and at home. To add to that, they aren't getting any younger. But that doesn't mean nothing can be done to make them stronger than ever before. With a change in lifestyle, Filipino adults now more than ever need to keep their bodies strong and healthy so they can keep moving for the ones they love and for themselves even as they age. At dahil kailangan ng bawat Pilipino ngayon na mapanatiling malakas at healthy ang kanilang katawan, handog natin ang brand new Anlin 5X. Packed with calcium for bones, protein for muscles, collagen plus vitamin C for joints, and now strengthened with B vitamins and new MFGM Active for energy and flexibility. This brand new offer is clinically proven to improve lean muscle mass by 40%, boost flexibility by 2 times, and improve balance by up to 3 times. Anlin 5X will be a strong enabler of movement for Filipino adults together with the Anlin everyone knows, Anlin Move Max. Now with a new look and new name as Anlin 3X. Still delivering the same benefits of calcium for bones, protein for muscles, and collagen plus vitamin C for joints. With a new Anlin 5X and the refreshed Anlin 3X, we get to fulfill our mission to make Filipinos stronger and healthier today, to keep moving for a better tomorrow. We must share the goodness of Anlin to everyone. Now it's in your hands to bring lakas at dixit to the nation and make sure that every Filipino adult gets to drink a glass of Anlin every day.
Tara, sama-sama tayong palakasin at paliksihin ang buong Pilipinas. With lakas, diksing Anlin!